How are you? Thank you. All right, thank you everyone for being here today. If we're ready, I'm going to provide COVID update data, reopening steps. Chief Martinez will also provide some other health conversations around COVID and take some questions in a little bit about that. I want to start by just addressing the murder in Georgia on Tuesday and the impacts here in our community here in Boston. There's no question that these were racist attacks, and Asian women were victimized here. This follows an increase of hate crimes for Asian Americans over this past year that we experienced all across this country. I know that this is an emotional and frightening time for many of our Asian neighbors and friends. I want to say to that end, I stand with you and your city stands with you. We will not tolerate any kind of hate or hate crimes here in the city of Boston. I encourage any victims of crimes, regardless of your immigration status, to report them to the Boston Police Department. The police will investigate and arrest any offenders if they find them. I also encourage anyone to show your support and concerns for the Asian Americans and Pacific Islanders community. Reach out to your friends and neighbors, support the AAPI-owned businesses, and do not tolerate any hateful comments or stereotypes. We're asking you to speak up if you see them happening in our city. We need to be intentional about eradicating racism out of our communities. And right now, the city staff are working with local nonprofits all across the city to see how we can best support our Asian community here in the city of Boston. Our Health and Equities Task Force has drafted a statement condemning anti-Asian hate and urging all of our elected and community leaders to combat this trend. Anyone who needs help or feels they need help to please reach out to the Mayor's Office of Immigrant Advancement by calling 311, or you can, if you're in the city of Boston, if you're outside the city of Boston, you want to reach out to our office, you can call 617-635-4500, or you can visit the website, our office at boston.gov/immigrants. I also want to just ask everyone here with me today and at home if you could join me in a moment of silence for the victims in Atlanta and the victims of racist hate crimes everywhere. Thank you. And I also want my friend Mayor Keisha Lance Bottoms to know that we are thinking of her and praying for her city here in the city of Boston. The latest COVID numbers I have yesterday's numbers and I have today's numbers for Boston, but yesterday's state numbers, 1,857 new confirmed cases. There were 27 deaths recorded yesterday. The Boston numbers today, 237 new confirmed cases, bringing our total cases to 61,746. We had 2 deaths that were confirmed, reported today, bringing our death total to 1,322. Our thoughts and prayers are with the families who lost loved ones during this very difficult time, and also people that are sick and suffering still from this virus. We want you to know you're in our thoughts and prayers as well. The latest complete data that we have for the week ending March 11th, an average of 3,831 Boston residents were tested for COVID each and every day. The 7-day average for daily positives was 153 cases. The average daily positive rate was 3.5%. The ICU occupancy has continued to go down, which is a good trend to see, that we want to continue to see that go down. The case numbers have stayed below our thresholds of concern for about a month now, and we are ready to move forward reopening. So we're happy in the trend we're going. We're obviously not where we completely want to be, but we're getting to a better place. The trend has been flat for several weeks, though, so we did see a decline, but it's been flat for the last several weeks. So we know that we still have work to do to make sure that we combat this virus. Updates on Phase 4, Step 1. On Monday, this coming Monday, March 22nd, the Commonwealth of Massachusetts will move to Phase 4, Step 1 of its reopening plan. That means that the more types of activities and industries are going to be allowed to open statewide in the Commonwealth. The capacity limits for venues and public settings will be also expanded. In Boston, we were going to move into a modified Phase 4, Step 1. This is consistent with the cautious approach that we've taken throughout the pandemic. It's not lots of changes, but there are some changes that we are not going to be moving forward with as much as the state. We're going to go over the key aspects of the state's transition from Phase 4, Step 1, and how the city of Boston is going to approach a little differently. Starting Monday the 22nd, the state will allow indoor and outdoor stadiums arena and ballparks to open at 12% capacity, limit in place. They also have submitted a plan to the Department of Public Health. The City of Boston is going to align with the step. So that means that Fenway Park and Boston Garden will be able to have 12% capacity at indoor and outdoor events, which includes obviously in other areas in the city. We'll only allow these venues to go above 12% if the state eventually allows it. So we're not going to go beyond it. We're going to wait for the state to move forward. And we also want to make sure that we have certain parameters in place that are safe so as we expand the seating in those different places. Boston's positivity rate, we're looking at a consistent positivity rate to go any higher than that to 2.75% for 2 consecutive weeks. Right now we're at 3.5%. We've seen declines. We've been kind of flat for a little bit here at 3.5%, but we want to see if the state increases the capacity. As of the moment, we want to see our rate in Boston come down to 2.75%. We're also requiring that these venues submit a safety plan to the city's licensing board. A safety plan in place. We have been working with the TD Garden. We've been working with Fenway Park. As a matter of fact, probably about 2 months ago, I actually went over to TD Garden and did a tour. I was over there for an event they had, and we did a tour afterwards. They put a lot of precautions in place, anticipating when fans would come back on the building. So I want to commend them for the way that they're operating at the Garden and some of the safety they put in place. Starting this Monday as well, the 22nd, the state's going to expand gatherings limits for event venues and public settings to 100 people indoors and 50 people outdoors. The City of Boston's we're also going to increase the gathering limits for event venues in public settings, but they will not be as high as the state's limit. The City of Boston will increase the indoor gathering to 60 people indoor and 100 people outdoor. And again, to increase those limits, and we can move to those limits in a faster way if we get to under a 2.75 positivity rate for 2 consecutive weeks. So when we hit that goal of 2.75, hopefully over the course of the next couple of weeks here, we keep it consistent for 2 weeks, then we will go up to the state number. Under the state guidance, outdoor gathering limits at private residences will remain in a maximum of 25 people, and the limits for indoor house gatherings will remain at 10 people, and the city will consistently line up with the state. The state is allowing dance floors only at weddings and certain other structured events, and overnight summer camps will be allowed to operate in the state. The city is going to continue to go on with that one as well, so we're going to follow the state guidelines on that. Exhibition and convention halls may begin to operate following gathering limits and protocols. The city is also going to align with the state on that piece. As a reminder, in late February, when the state moved into Phase 3, Step 2, the City of Boston held back on some aspects. Starting on Monday, March 22nd, we will move those activities up to Phase 3, Step 2 levels. That means indoor performance venues, such as concert halls and theaters, will be allowed to reopen at 50% capacity with no more than 500 people. To be clear, this only applies to venues where the audience members stay in designated seating. Indoor recreational activities like laser tag, roller skating, trampolines, obstacle courses, escape rooms, I'm not sure what that is, will be allowed to open at 50% capacity. Live musical performances will be allowed at restaurants in Boston. This includes all live entertainment except for singing. Singing will not be allowed at this point indoors because of the risk of spreading droplets. All of this information, I know the press is, you're writing it down really, really fast here. If you just go to boston.gov/coronavirus, we have it all listed out there for you in a nice way. And I'm sure I might have read it wrong, so you'll get the right, accurate information if you go online. So please, and for people at home, boston.gov/coronavirus. I just want to say a couple of things I want to emphasize on our approach. Our case numbers and hospitalizations are certainly below our thresholds, and they're lower than they were in January. But we're still higher than they were last summer. I talked to some people that in the hospitality industry, and I know we spoke today on the phone, and you want to see us move quicker, and I'd love to move quicker, but we still have a long way to go. The virus is still with us here. We have less than 15% of the population vaccinated, although we have 15% of the population vaccinated, which is a good thing. but we're not going to go as far as to state on everything because of who we are in Boston. We have 700,000 people that live in the city of Boston, and we still have lots of people coming in to the city for various, whether it's schools or hospitals or work or things like that. So we want to make sure that we are being careful here in the city of Boston. That being said, we also are working to advance our economic recovery. So I want to thank the city staff, residents, businesses, owners for helping us prioritize public health while bringing our economy back in safe ways. And I also want to give a shout out to the press, and because you cover these stories every day, and I see them on TV and in the paper of the businesses trying to open and the struggling that they're having. So we need to do everything we can, and the radio, I should say. So we need to do everything we can to get these businesses back. In order to do that, we need everyone to do their part. Businesses and event venues must enforce all protocols. We're working with you on your safety plans to submit to the state and city any plans that you have for over 500 people. For any information on that, go to boston.gov/licensing. And industries that continue to let your workers work from home, I want to say thank you. And if you can, at least once in a while, just so we can continue to see these numbers go down. For individuals, when you're at a restaurant, you go into a restaurant or a business or events, we're asking you to follow the safety rules put in place. We're asking you to please be respectful to the staff working in these places. If you don't have a mask on and they don't want to let you in, then you're not going to get in. If you're walking around and you're walking to the bathroom, ladies' men's room, and you don't have a mask on, they ask you to put a mask on, put the mask on. Because these people that are working in restaurants and retail shops certainly have their own families they're concerned about, and they need to work. So we're asking you to do that. We're asking you to don't just see the rules being made. Make it part of your job to enforce them. Wear a mask. We're asking people to wear masks. Wash your hands as often as possible with soap and warm water. That's for your own benefit. If you're gathering with people, do it safely and follow the public health guidelines. We have one more weekend around St. Patrick's Day, which is probably going to start tonight into tomorrow and Sunday. So we're asking you to keep up the precautions. We're asking people to be careful. We're asking you to watch out for the people around you. If you go out there, we're asking people not to be standing in lines. We're not allowing lines in the city of Boston. Last weekend we had the restaurants had a great weekend. There was no violations at all. Let's do the same thing for this coming weekend moving forward. And I promise you next St. Patrick's Day weekend you can have as much fun as you want. And there'll be lines everywhere, and hopefully we'll be a lot further, in a lot different place than we are today. If you've been vaccinated, we're asking people to follow the CDC guidelines on activities you can do safely. Go to cdc.gov to learn about that. If you get tested frequently, and we're asking you to get tested frequently. We have 25 sites in the city of Boston. As everyone knows, you're probably sick of me talking about these sites at this point, but it's in Jamaica Plain, Hyde Park, and Dorchester. If you go on to boston.gov, you can get all the information for all the testing sites in the city of Boston. On the vaccine update, this week the governor announced the full schedule of vaccine eligibility. Who's eligible right now for vaccines to actually get a shot? Those are 65 years and older. Those are 2 medical conditions. Those with long-term and congregate care settings, healthcare workers and first responders, residents and staff of low-income senior housing, teachers, school staff, and child care workers. I want to thank our public safety, first responders in Boston, particularly our police and fire and EMS, who have gotten the shot. Thank you for doing that. I'm not hearing these stories that we're hearing in other places, people not getting the shot. Our first responders are. I also want to thank the teachers who have gotten the shot and the staffs who have gotten the shot. And I know I've talked to some teachers today at a school, and they're excited about it. I think they're getting the shot this weekend. So I want to thank you all for getting that shot. Becoming eligible Monday, also the 22nd, are anyone 60 years or older, certain frontline workers, including restaurant workers, grocery store clerks and workers, food pantry workers, retail store workers, transit and transportation workers, public works, utility and sanitation workers, public health and vaccine development workers, court workers, and funeral home staff. So all of those folks will be eligible starting this Monday to get their vaccinations. Starting April 5th, I'm going to kind of confuse you a little bit here, but I'll be quick on this, and then I'll give you a website again. Starting April 5th, all adults 55 or older and all adults with 1 medical condition will be eligible. That's in a couple weeks on April 5th. On April 19th, all individuals 16 years and older will become eligible for the vaccine. For complete information available, you can go to mass.gov and get all of the information on vaccines. You can also pre-register there for max vaccination sites, and we have a few in the city, and as the weeks go 311. We'll probably have a couple more places that will do it as well. Having target dates is good news for everyone, but it's also important to remember that access to an appointment depends on supply of vaccines. And I know that we've heard President Biden talk a lot about getting more and more supply of vaccines to states around the country. That's something that we need to continue to work with the federal government on and push the federal government to make sure we get more vaccines into cities and towns all across America. So it's going to be really important that we do that. In Boston, we're focused on access for most of our highly impacted residents, including seniors and those in the hardest hit communities. We're going to keep putting equity at the heart of our local efforts here in Boston. We have vaccination sites all across the city of Boston that are open and eligible for all residents, and we have the resources to help people access them. If you have any questions on vaccines in regards to the city of Boston, go to boston.gov/COVID-19 vaccine. And that will give you a map of all the vaccination sites that we have in the city. So we have some general vaccination sites, we have some pharmacies, we have some health centers and other places doing vaccines. So that's really important. If you're 65 and older and you haven't signed up for a vaccine and you're concerned about the computer or figuring out how to use it, just simply call 311 and our Age Strong Commission will help you. 65 and older, any residents that have not been vaccinated, right now, if you feel like, okay, I want to get vaccinated, I don't know what to do, just call 311. We will help you with that process. If you are watching this right now and you are not a Boston resident, you said, how do I get vaccinated? And you don't have a computer, call 211, and that will connect you to the state. So it's 311 if you're a City of Boston resident, 211 if you're a state, if you're not a City of Boston resident. We're going to continue to have mobile vaccine clinics at affordable housing developments and seniors with disabilities, so we're going to continue to do that. We're continuing to hold Marty Martinez able to work with Mary Lou Sutters at the state, along with Governor Baker, to hold 50% of the slots at the Reggie Lewis Center in Roxbury for people of color in the community. It's important that people understand that. I can also announce today that we have created a new web and phone support for accessing those appointments. So for the city of Boston, again, I'm going to give you another number, 617-635-5555. 617-635-5555, and I'm just gonna our 311 call takers, just call 311. We can connect you to that number as well if you need it. For our immigrant communities, we're hosting a series of webinars on vaccine. The next one is on Thursday in the Cabo Verdean in Cabo Verdean Creole. So we need to make sure that our immigrant community, our immigrant population, gets vaccinated as well. So if you work with somebody who's an immigrant that might have a language barrier, please talk to them about making sure that they have access as well, and that they can call the City of Boston. We can help them with that. For veterans of all ages, if you're enrolled in VA healthcare, you can get vaccinated at any VA healthcare facility. Tomorrow, March 20th, we are partnering with the VA on clinics at Urban Edge on Columbus Avenue in Roxbury from 10 a.m. to 1 p.m. Free transportation is available, but we're asking you to call ahead to boston.gov/veterans or call our veterans office in the City of Boston at 311. It's also been very good to welcome our students back into our schools for hybrid learning this week, and BPS continues to work towards the state's directive of full-time in-person learning. Boston Public Schools, Dr. Brenda Casilius sent out learning model selection forms earlier this week. Families are asked to complete them by Monday the 22nd. This is important work. This is about whether or not you want to send your kid to in-person or continue at hybrid. This has been a tough year for students and a stressful one for families, but we also have some good news to share. Before I get to the good news, I just want to give a shout out to the teachers and the staff at our schools. In the last 3 weeks, I have visited, I think, 14 or 15 schools in the city of Boston. I am so impressed with watching the teachers to be able to teach hybrid model, actually literally teaching the kids on Zoom and having kids in the classroom and doing an amazing job there. I'm impressed with the lunch monitors being able to provide food, not only for the kids inside school, but also for the kids outside of school. I'm impressed with the bus drivers who are driving our kids off. I think that their on-time ratio the last 3 weeks has been 95%. And I'm impressed with the kids that are in classroom that are so excited about being there. and the kids that are on Zoom that want to come in. So it's been amazing to watch this, and really one of the things I'm going to miss the most about this job is going and seeing our kids in our schools, and watching this last 3 weeks has been unbelievable. So I want to just give a shout out to all of our teachers and our bus drivers and our lunch monitors and our staff and our principals and our district. They deserve it. Yesterday, the state released data showing that the Boston Public Schools for the year 2020 school year had its highest four-year graduation rate ever recorded. I want to correct that, so I read that in the paper tomorrow. Boston Public Schools had the highest four-year graduation rate ever recorded in the city of Boston yesterday. That is a good story. That's a story that we should be watching on TV and we should be reading about in the paper. And that's because of our teachers, and that's because of our principals, because of our superintendent. It's because of the taxpayers of Boston, the investment that you've made in the city of Boston over the last 4 years. And most importantly, it's about our kids, the young people that go to school every day and work hard every single day, who graduate, and many of our kids are going on to junior colleges and work. So I want to give a shout out to our kids. That rate went up from 73.2% in 2019 to 75.4% in 2020. And we've increased the graduation rate by nearly 9 percentage points since 2014. When I say we've done it, our kids have done it. They've done an amazing job doing great work. So, I'd love to see that they have a chance to read something or see something about their success. That's something that our kids need today. Black and Latino and white students, as well as both male and female students, have all increased their graduation rates. It's across the board everywhere. The dropout rate also went down across most groups, including English language learners. So we've seen dropout rates go down. We've seen more kids going into school. I am so proud of the class of 2020. In their senior year, they faced something no class has ever faced, or at least in 100 years, a global pandemic. It was frightening, and it impacted our communities and their families. But they adapted and moved forward. Our school staff, our district people, as I said a minute ago, also accepted it and adapted as well to do all this amazing work. So again, to our students, congratulations. Thank you to all the parents and guardians and people and teachers who have supported them. And I want to thank the staff. I want to thank the coaches and counselors and everyone that helps. We still have lots of work to do in our schools, as well as reopening and recover. But these numbers show that our students are resilient and our community is committed to supporting them, and we can continue this great progress together. So congratulations to all of them. I also want to just close by announcing about the family work benefits for City of Boston employees. This is an important economic issue. It's been highlighted by the pandemic as child care has been the hardest to access. We depend on working parents and families to move us forward. We have to support them, because if they can't make things work, then our economy won't work, and something that we have to continue to do. This has been a focus of mine for a long time. I was the lead sponsor at the State House of the Massachusetts Parental Leave Act, which made paid leave available for all couples for the first time. In 2015, in the City of Boston, we filed it as well, I signed the City of Boston's first ever paid parental leave policy for eligible employees. Today, I can announce that we're expanding that benefit. Eligible employees can take up to 12 weeks of paid parental leave during the first year after the birth or adoption of a child. This doubles the current health benefit for employees. It will now provide 100% income for 4 weeks for people who work for us, the city, 75% of their pay for weeks 5 through 8, and 50% of their pay weeks 9 to 12. And if both parents are eligible city workers, each of them are entitled to this full benefit. This policy improves the employee's experience, modernizes our workplaces, and supports the ability to attract and retain talent. This is good for the quality of city government, and we're setting a good model here for other employees. By helping working parents, and we can help the economy come back stronger than before. I'd like to say that I'm thrilled that we're doing this in Boston. We should be doing this all across the country. But if you look across the country, we are nowhere where other industrialized countries are with paid family leave. So we have lots of work to do here in Massachusetts and beyond Massachusetts, and we can work on that next week. With that, I'm going to turn this over to Marty Martinez to give a little more of an update. He's going to take COVID questions. I know people have questions for me. I will probably be having a press conference on Monday, and I'll be able to take anyone and everyone's question. Marty.
Transitioning to a more national
Well, I really can't, but if you notice today's press conference, I had about 35 pages of remarks, so I guess I didn't want to leave the press conference, so I'm going to turn it over to Marty, and then I promise you on Monday, I will answer any question that's asked of me.
So I'll be glad to take any COVID-related questions you might have.
Yep. Concerns that the numbers are flat, that they're not actually going down, and how does the variance play into that? I guess the bigger question is, should people be hopeful right now, or just are we looking at down the road at something more?
Yeah, so the question is, do we have concern about the numbers being flat and obviously the variant and other things that are part of it, and should people be hopeful? I think it's both. There's sort of yeses to both those questions, right? We want people to be hopeful. Obviously, we are getting Bostonians vaccinated every day, more and more fully vaccinated, greater access, and in many ways doing a good job on the ground. Having said that, our progress has gone flat. We have seen 2 days in a row now where we've had cases over 200 cases a day. But again, things have moved in the right direction. But since that progress has gone flat, we're trying to be cautious as we think about not only reopening, but as we think about what we're trying to do. So I think it's really important that everyone continues to wear their face covering, socially distance themselves, hand hygiene, and also get vaccinated, because that's a huge tool to sort of get back to where we want to be. So we're trying to measure this out. Positivity definitely has come down from what it was earlier during the surge, as hospitalizations have come down. So those things have all come down, which is why we're going forward with some of the reopening. But because of that flattening, it's why we're going cautiously forward.
Chief, as we get past 1 million people fully vaccinated, what's the advice in Boston? I talked to a restaurant owner the other day, and they said that they were seeing a lot more 65 and olders coming in. They're vaccinated. They want to get back out. What is the best rule of thumb to get people out in the public when they have this protection?
Yeah, so what's the advice for those who are getting fully vaccinated, especially as we see, potentially older Bostonians being able to do that? We're also seeing, my response to that would be, we're also seeing older Bostonians vaccinated, which is super important. It's also why we've seen lower severity in our hospitalizations, lower numbers in the ICU, as that age has trended older. I think it's important that as people get fully vaccinated, we want them to be able to, re-engage. We think it's important to be mindful of who else you're around, since again, most Bostonians are not fully vaccinated. Wearing a face covering is still required in indoor spaces. And so I think it's caution. We want people to remember that being fully vaccinated gives you some protection. It gives you protection, and it's going to allow you to re-engage. But I think we got to do it slowly, which is important, especially given the fact that the majority of folks aren't vaccinated. So the CDC released guidelines. The state is also getting ready to release some guidelines related to it, which will be important that we follow that. But I think my word to folks is, I know we're all eager to re-engage, but we should do it slowly.
Any extra efforts to get people vaccinated quicker in the city? I saw the rate here was like 26%.
Yeah, for the city, for us, I mean, when we, like all things Boston, we calculated a little differently locally, because we calculated based on the percentage of 16 and older that's vaccinated, because those are the only people that are eligible. So we are seeing folks vaccinated at high rates, especially seniors, which is really, really important. On the ground, we're working every day. I came from a BHA site today. I'm going to a veteran site tomorrow where people will be vaccinated, our vets who are all eligible through the VA Boston. So again, we have all kinds of efforts on the ground to create access, which is a really important tool. But I don't want to lose sight that all these other tools we've used this entire time, we got to keep using, including getting tested, wearing face covering, and social distancing ourselves. Any other questions? Thank you, everyone.